I'm Dr. David Samra, a specialist sport and exercise medicine physician. I run Progressive Sports Medicine in Sydney and the Progressive Longevity Clinic, where we work with athletes, active adults, and increasingly people who are focused on long-term metabolic health, physical capacity, and their own healthy aging. My background is as a sport and exercise medicine physician, but much of what I'll talk about here sits at the intersection of nutrition, muscle, metabolism, and behavior. We're moving away from simple weight loss as a cosmetic goal toward health span as a clinical outcome. This session isn't about promoting a particular diet. It's about explaining why nutrition advice so often fails and how we think about nutrition more precisely in modern clinical practice. So why nutrition advice so often fails? Well, this slide captures a frustration that many people recognize. Most nutrition advice doesn't fail because it's completely wrong. It fails because it's oversimplified. We cycle through labels: low fat, low carb, Mediterranean, vegan, carnivore, fasting, and people often see short-term success followed by long-term frustration. A major reason is that much of nutrition science, which is historically quite hard to do well and limited in the quality and validity of data and designs, shows small effects that are easily overwhelmed by sleep, activity, stress, muscle mass, and baseline metabolic health. So when advice is delivered as absolute truth rather than probability and context, people understandably lose trust. Everybody eats, so everyone has an opinion on this, and the modern goal isn't to discard this nutrition science, it's to apply it with some humility and also try to improve our precision. Most population nutrition studies show associations, not mechanisms. Self-rated food frequency questionnaires that have for so long been a staple of nutritional research are notoriously inaccurate, often falling off by 30 to 50%. And nutrition research is hard for so many reasons. It's impossible to blind people to what diet they're having in studies. And also, people who eat healthier diets tend to exercise more, sleep better, drink less alcohol, and access healthcare earlier. So that creates this so-called healthy user bias and confounding. So when headlines declare a single food as good or bad, it's worth us asking, is this correlation or causation? In clinic, we care less about ideology and more about what actually happens inside your body. And nutrition needs to be thought of as biology. Value-based judgments need to be moved to the side. And this is where the conversation becomes grounded. Food is just a collection of molecules. By the way those molecules interact with enzymes, organs, hormones, and signaling pathways, we have different effects between individuals. The same food can produce very different metabolic effects in different people. Nutrition starts to make sense when we think about it in terms of biochemistry, rather than as moral categories like good or bad foods. So what happens after you eat? In different people, the same meal breaks down into its components: glucose, fatty acids, and amino acids. And those molecules are handled differently by muscle, which determines where things are disposed, glucose disposal in particular, the liver, which controls glucose production and fat synthesis, adipose tissue, storage versus release of that fat energy, and in the brain, satiety, fullness versus and reward. And in the gut, breakdown to other chemical messengers and metabolites. And so this is why nutrition advice that ignores other factors like muscle mass, insulin sensitivity, hormonal status, sleep, and activity in the individual often misses the mark. And context matters. If we look at the standard Australian diet, we see why we've been getting metabolically sicker over decades. I don't think any experts in the field would argue that the ultra-processed, hyper-palatable foods that are so readily available to us haven't contributed to our health issues as a society. But nutritional guidelines have struggled to help us keep up with this and change this, and they can only do so much broadly and generally. Two people can eat the same meal and have completely different outcomes. Even the same person can respond differently to a meal depending on other factors: sleep, stress, activity, recovery. So this is why generic advice often fails in well-intentioned people. The context has changed. And there are really only 3 levers to all diets. I think this is one of the most important frameworks. All of these diet labels out there can differ, but the physiology does not. All diets work through some combination of these three levers: how much you eat, caloric intake; what you eat, dietary restriction; and when you eat, time restriction. And none of these is universally superior. The success far more depends on whether the levers match your biology, lifestyle, and capacity. And the most sustainable approaches deliberately combine more than one lever. And now we're on to calories versus food quality. What we have in this slide is some nuance from high quality research. We see that studies have shown that calories absolutely matter, but food quality determines how many calories you end up eating. Now, ultra processed, hyper palatable foods that taste amazing drive reward-based eating, that drive blood sugar swings and low satiety, making restriction exhausting. But high quality diets with adequate protein, real food, fiber, minimal processing often reduce intake without conscious restraint. And that's not magic, that's biology working properly, and it's well supported in well-controlled research. So this is why dietitians are so critical in providing individualized assessment and advice. We know that behavior, reward, and physiology are tightly linked, and it needs to be individualized. So this is where modern nutrition moves away from dogma. The macronutrients that we can take in, there's only 3 of them really, they're tools, they're not teams to belong to. Protein is a non-negotiable essential, especially with aging. Carbohydrates are context dependent and based on activity and insulin sensitivity and timing. And fats really depend on the quality and the individual lipid responses of the person. Alcohol is biologically non-essential. It disrupts sleep, it displaces protein, and adds calories without satiety. It does have a role, but not for nutrition. And the better question is, rather than what's the best diet, it's at what dose, what is right for me, what is right at this time. Why measurement matters. The same meal, as we've mentioned, can have different influences and different glucose responses in different people. And those responses change with sleep, stress, training, and recovery. This is why measurement matters. And we have the ability to measure biofeedback, body composition, wearables, and particularly continuous glucose monitoring turns nutrition from guesswork into guided N-of-1 experimentation. When people can tangibly see cause and effect, behavior change becomes far more durable because seeing is believing. And we really want to focus on continuous rather than episodic care in this day and age. We're no longer limited to sporadic clinic visits and memory-based recall. With consent, we can integrate wearables, food diaries, online food diaries, and CGM data all together to look at trends over time and personalised dietary advice. This allows us to move from retrospective advice to proactive adaptive care. So we've got to use that data and use it with context. These wearables are great, and they do give us insight into sleep, recovery, activity, heart rate variability, and stress. And this does influence nutrition and insulin sensitivity. But the value isn't the data alone. It's how we use that data to contextualize decisions so nutrition fits your life. So there's no single profession that owns nutrition for longevity. As sport and exercise physicians, we provide risk stratification, metabolic targets, and medical oversight. Dietitians translate the physiology into food and behavior that fits each individual's real life. And physiologists build muscle and insulin sensitivity in relation to that patient's goals. And when these roles work in silos, the advice fragments. But when we're aligned, right messaging occurs and patients improve in their metabolic health. So nutrition is an adaptive system. It's not set and forget. We need to go through the cycle of assessment, design, implementation, measurement, and iteration. Because people change, circumstances change, and goals evolve. So the aim again is not perfection, it's progress with feedback. The core takeaway today is that modern nutrition works best when it's treated as biology, not ideology. When physiology, behavior, and environment are aligned, nutrition becomes sustainable rather than overwhelming. So the next time you see a headline declaring the world's best diet, smile to yourself and move on to something more important for you. This content is provided for general educational purposes only. It is not intended as medical or nutritional advice and does not replace consultation with your GP or treating health professional. Nutrition, metabolic health, and dietary strategies should always be considered in the context of individual medical history, lifestyle, goals, and risk factors. No patient-doctor relationship is established by viewing this content. If you have health concerns or symptoms, please speak with your GP or treating specialist.